my YouTube channel. Today we are going to very important topic: which drugs are safe in pregnancy and which drugs are contraindicated in pregnancy. We are mainly discuss it about the analgesics, antibiotics, antiemetic, medicine used in cough, allergies, and all over the body. We will discuss those medicine which are safe in pregnancy and those which are indicated and contraindicated in pregnancy. This is a very important topic. We expected it. You will like the video and hope you will learn a lot about the video. Let's go to the screen site. So those antibiotics which are safe in pregnancy, you can remember these through a very easy mnemonic. Mom take really good care safely. It's a universal truth as well. So sulfonamide, aminoglycoside, fluoroquinolone, and erythromycin, ribavirin, graciofilin, chloramphenicol. These are very easy mnemonic. So now we are going to discuss the drug during pregnancy and lactation. First, we will mainly discuss the analgesic and anti-inflammatory drugs. The first one is paracetamol. Acetaminophen is a drug of choice in pregnancy. Aspirin is the second one after paracetamol. Morphine, which is indicated in a special condition because it causes the neonatal respiratory depression, and codeine may be used as an analgesic for pregnant women if paracetamol is not sufficiently effective, and fentanyl used only in urgent conditions. It's also cause the respiratory indication. Ibuprofen and diclofenac can be considered in first two trimester only when after 28 week of pregnancy it's become contraindicated. And no, if a patient presented with disease modifying anti-rheumatic condition, which drug are used? Sulfasalazine as first drug of choice during pregnancy, azathioprine, cyclosporine, and hydroxychloroquine, chloroquine, and gold compound depenicillins are reserved treatment option in this condition. If a patient, pregnant patient presented with gout, you prescribe them. Allopurinol is contraindicated. Epinephrine is the drug of choice in this condition. If patient is presented with gouty attack, ibuprofen is the drug of choice and colchicine is the second drug of choice. A patient with anti-allergic with pregnancy, so anti-allergic drugs and desensitization, the antihistamine H2 blocker, first generation and second generation, the chlorpheniramine and dexapeniramine and so on. And second generation, you can get loratadine and cetrazine, first line treatment and second line treatment. These are the anti-allergic safe medication in pregnancy. Other one is immunotherapy. Allergen immunotherapy can be carefully continued during pregnancy and patient with benefit and not experiencing adverse reaction. And other antihistaminic and cough medication if a patient presented with cough and pregnancy, so you can give selective B2 adrenergic agonists like salbutamol, metoprolol, and terbinolene is the first line therapy because they are short acting, and formoterol, salmeterol, they should be used if the other option is failed. They are long acting. Beta 2 adrenergic agonist. Another is a corticosteroid. You can give corticosteroid and like beclomethasone, betnicide. These are first line, and systemically you can give prednisolone only if indicated in acute exacerbation of asthma. Its metabolite also used, and intranasal corticosteroid for allergic rhinitis. They are also safe. Anticholinergic drugs, ipratropium bromide inhaler, first line treatment in this case. Other ones, theophylline may be used for the severe cause inhale. If the beta 2 agonist and corticosteroid is insufficient, you can give theophylline and asthmatic crisis. And sodium chromogylate can be used for the prophylactic treatment of allergic disease. Other expectorant and mucolytic agent N-acetylcysteine, and other two drugs are safe during pregnancy as a mucolytic and expectorant, and other intercessio which suppress the cough, like codeine and dextromethorphan for cough, can be given in all trimester of pregnancy. Non-selective beta-adrenergic agonists are not recommended for the asthma treatment and pregnancy. It should be kept in mind. And antiemetic, like for we can give it through nausea and for vomiting in pregnancy. So antihistamine, the first and second generation, which as we have discussed later and earlier, they are safe and effective treatment for nausea, vomiting, and doxycycline should be the first choice, preferably combined with vitamin B10, as here in Pakistan we give as nevidaxine. And the second generation, such as meclizine, should be used as the sedative effect of the first generation of antihistamine. Dopamine antagonists are widely used, and metoclopramide seems safe and efficiency, less of the sedating property, and metoclopramide is the first line treatment in this case. Pyridoxine, vitamin B12, initial dose is 40 mg per day and maximum dose is 80 mg. If vitamin B12 alone is not successful, then combine with antihistamine 10 mg, anyone as we have discussed in earlier stages. Thiamine, vitamin B1, 100 to 500 mg IV for 3 days for anti-vomiting and nausea if it's present in pregnancy. This is the dose as we have discussed. And here is IV dextrose should be given without pre-administration of thiamine. It is the metabolite of the dextrose consumed by remaining B1 and may worsen the symptoms. So other as acid like glutamic acid, citric acid, pepsin protease are indicated therapy during pregnancy. If a patient presented with constipation and pregnancy, so how you will manage by three-way stool bulking agent, like you can give to resolve the constipation, all stool bulking. Absorptions are safe in pregnancy, we'll discuss later. And hyperosmotic and saline laxative lactulose like sorbitolol and other laxative, and we can use in this stage. And diphenylmethane, when bulk and osmotic laxative are failed and ineffective, then first drug of choice is this one. So castor oil, as we have discussed here in note, castor oil should not be used during pregnancy because it may stimulate uterine contraction and lead to abortion. And antidiarrheal and dietary changes, and in case where drug indicated inhibition of intestinal motility, loperamide can be used as it decreases the intestinal motility and prevent the diarrhea. Antibiotic, the most important things which commonly used everywhere during pregnancy, so we should need to focus on these things. Penicillin, the beta-lactamase antibiotic, first line drug of choice which is used, and cephalosporin and beta-lactam inhibitor. We can use if we needed macrolide, erythromycin, and azithromycin, clarithromycin, and these are the drug of choice in macrolide if it's indicated in the patient with pregnancy. And lincomycin, clindamycin are only indicated when penicillin, cephalosporin, erythromycin are ineffective. So it's a second line option with you people. Sulfonamide, trimethoprim, cotrimoxazole may be safely an alternative drug for other antibiotics. Most commonly, if it's a patient presented with UTI and pregnancy, you can use this one as alternate medicine. Quinolone should be used with caution, and it's depend on trimester. Quinolone are not indicated in first trimester, so it should be used with caution. Polypeptide antibiotic like vancomycin used only in special conditions. Aminoglycoside not recommended parenterally during pregnancy, and chloramphenicol contraindicated during pregnancy unless there is serious indications. Other serotonin antagonist CNS medicines, if we discuss here, aldosterone should be used if other antiemetics fail. It's for the vomiting, and corticosteroid, as we have discussed earlier, is used in intractable hyper MS gravidas instead of dehydrations. Gastritis, pepticals, we can give antacid, so sucralfate is a drug of choice, and H2 receptor antagonist, PPI. These are the other option. If the antacid and sucrosulfate failed, then we can give omeprazole, mainly in the reflexes, esophagitis, and the burning sensation of the stomach. Patient with, if present with H. pylori positive pregnant patient, then you can eradicate through H. pylori therapy, but you can give amoxicillin because it's safe, to clarithromycin and PPI. So this triple therapy is safe. Instead of flagyl, you can give amoxicillin. Other OTC medication during pregnancy, the safe medicine acetaminophen. And what is the problem with this medicine and pregnancy? Because it pain relief, headache, fever. If you have pain and headache, fever, you can take acetaminophen. If you have problem allergy, how you will get relief from the allergy? Take chloramphenicol, antihistamine, loratadine, dimenhydramine. If you have cough and cold in pregnancy, you can take grisfelvin, expectorant, dextromethorphan, and cough drop, and Vicprob, as we have discussed earlier. If you have a fungal infection during pregnancy, you can take clotrimazole and meconazole and ticonazole, butoconazole, and tonalfate. As we have, you are seeing here, it's written. These are the drug of choice, safe choice is an antifungal infection. If a pregnant patient presented with insomnia, loss of sleep, you can give dimenhydramine and diloxamine succinate. For the itching, you can give a topical hydrocortisone as well. If a patient presented with constipation, hemorrhoid, and diarrhea, you can give Phyllium and Pylocarbofel, and for hemorrhoid cream, you can give him locally loperamide and methyl cellulose as well. For heartburn, if a patient presents with stomach upset and complaining of GERD and esophagitis, reflex esophagitis, you can give the antacid and simethicone for the gas pain. If not relieved with the antacid, you can give sucralfate, drug of choice, and the last option is the PPI is omeprazole. And for the cuts and scrapes, you can give polysporin. For the rashes, Benadryl cream and Colloidal lotion is cream hydrocortisone as well. And other antibiotic, which is mainly safe in the priority order, there is amoxicillin, ampicillin, clindamycin, erythromycin, penicillin, and nitroglycerin. So these are the antibiotics. Let's give a quick review to these antibiotic. The As we first discussed, the pneumonic, the mom take really good care safely. The sulfonamide aminoglycoside, the fluoroquinolone, and erythromycin. These were the analgesics. The best one is the paracetamol, and this was the painkiller. Is also painkiller. The first one is also the paracetamol and sulfasalazine. In this case, the main and the last, we can see the antihistamine. The best one is the chloramphenicol or loratadine, and antihistaminic, you can give steroid as well. In this case, the expectorant, any cough syrup is almost all are safe, mainly which have codeine and dextromethorphan. And the antiemetics, you can give the uh, first line and second line antihistaminic medications. And vitamin B1 and vitamin B6 both are safe. If a patient with present with constipation, you can give almost all stool bulking agent except castor oil because it causes the uterine contraction. In case of severe diarrhea, you can give loperamide, and the antibiotics are safe. The penicillin, cephalosporin, macrolide group, vancomycin, sulfonamide, quinolone, and polypeptide antibiotics, and chloramphenicol, which is chloramphenicol is not safe. Remember it. And other serotonin inhibitor, aldosterone, and corticosteroid, as we have discussed in asthmatic conditions. So these are the summary. If a patient presented with pregnancy and pain, you can give the acetaminophen anti-allergic, you can give the chloramphenicol, and cough you can give antitussive, which contain the codeine dextromethorphan, and fungal infection clotrimazole, insomnia, dimine, hydrominate, and for the itching hydrocortisone. For constipation, you can give the bulking foaming agents like polycarbophil, and for diarrhea you can give loperamide, and for heartburn antacid and PPIs, and for the rash Benadryl, and the last again antibiotic safe amoxicillin. Almost this video covered the whole body and pregnancy from head to toe, as skin and infections and vomiting and anti-allergic, and mainly it's cover the commonly used problem with medication. Hope you will learn a lot of from this video. If you have, so like, subscribe my channel, and share the video with your friend. And for further such like videos, I have give a link in description. You can see there for the further information. Thank you. Assalamu alaikum.